Hello, everyone, at the Week of Happiness. I'm so grateful to be here. I've been a part of this for many years. I think this is our third year, and I'm really grateful to be sharing what we're doing in education. So I lead and curate the day on health. But we also have a program for kids, which is a big, how I really got started in this space. So I'm really excited to share with you what we're teaching kids. The goal of my talk today is to introduce you to the concept that hope is teachable. B, to really give you the definition of hopelessness and hope and share why I think it's so critical right now that we teach hope to young kids. 3, to kind of share what Hopeful Minds is, which is our free program that teaches the how-to of hope. And also share a little bit about what we're doing to operationalize hope throughout a city through our Hopeful Cities movement. Just touch on that briefly as well. So anyway, thanks for listening today and for joining. Really, again, awesome to be speaking with you. So about 8 years ago, maybe, I've been really active in the global mental health community for a long time. I run a company. We did the first nationwide cause marketing campaign for mental health. And when we got some funding, I really wanted to address a specific sector that I thought people didn't focus very much on. And that's really suicide prevention at a truly preventative place. So not in times of crisis, but really looking, if we want to prevent suicide, how do we fundamentally go about doing that? And hopelessness is that single consistent predictor of suicide. You can be hopeless about one thing, about several things, about everything in life, but really it's that single consistent predictor. It's also predictive of things like addiction, violence, self-harm, all kinds of negative life experiences. And so what we did is we aimed to figure out how you would teach hope, right? So hopelessness is defined as that feeling of despair and that sense of helplessness. So, if you're hopeless, you feel horrible, despair, and it's motivational. So you don't feel like you can do anything about it. And that is really key when it comes to hopelessness. Because oftentimes we think of hopelessness in obscurity or just as a really bad feeling, and that's actually not correct. What is true about hopelessness is it's that both that despair and that sense of helplessness, so that inability to act. So when we set out to teach kids hope, we work to teach how to get from that despair to positive feelings and how to get from that helplessness to that inspired action, and then how to create networks for hope and things that, some keys to hope. So we have a free global program that we've been studying and using around the world. And I'm super excited to share that last year we did a massive update based on years of research, and it's now new and improved Hopeful Minds. And I'm really excited about it and excited to share more with you. So I'm going to share my screen. First, to really teach you a little bit about hope overall and why it's a global imperative. We talk about deaths of despair right now, and they've coined that phrase, deaths of despair, yet I really believe it's deaths of hopelessness. So, if you remember that hopelessness definition is both that feeling of despair and that sense of helplessness. And deaths of despair only cover one component of that. And we're not dying because we feel horrible. We're dying because we feel horrible and we don't believe we can do anything about it. And that's really important and something my goal would be for you to take that away from this conversation. It's not just, we're not dying because we feel bad, because you can actually handle really awful, terrible feelings. Like I ran from my feelings for so long because I didn't think I could handle them. But yet I can always handle my feelings. But then when it gets to that feeling of I can't do anything about my despair, that becomes really, those two, in combination, are really what people are dying from. And I've overcome many challenges in my life, and many people have. And it is through learning always how to get out of that despair to those positive feelings and how to get from that helplessness to inspired action. And we've actually created ways that we can teach kids how to do this. Hopeful Minds is a free global program. And just to talk a little bit about hope, hope is predictive of your grades more so than your IQ. So, if you want your kids to excel in school, it's also important that they excel in hope. So our program meets SEL guidelines in the US, social emotional learning guidelines. It's also a really innovative way to address bullying, again, suicide and mental health. While we approach it from the perspective of hope and hopelessness, it's really a preventative attempt to address mental health and talk about mental health in a really proactive way. But again, we're not talking about depression and suicide with these K through 6. It's generally for K through 6, but it can be modified for any range. We're not necessarily talking about that, but we're talking about it from a hopelessness to a hope, and really giving kids that roadmap for how to get there. We use a trauma-informed kind of approach, and we also not only meet, but we teach national health education standards. And there are national health education standards in the United States set out by the CDC. And our program not only meets those standards, but helps reinforce and teach them. So it's a really innovative way to meet those standards. The statistics around hopelessness are shocking and terrifying, and we should all be doing something immediate and drastic for our youth around the world. It is a problem that's only been exacerbated by COVID, because kids have not had the skills they need to manage the stress and to focus on what they control and can't control, to find new habits for happiness, when we're in lockdown, when a lot of the things around us are restricted. And not only our kids experiencing this, adults are experiencing it as well. So, when students have both the will and the way to achieve their dreams, they're more likely to reach for their goals and hope for the future. We know that's key. We know hope is a key need of youth. And we also know that kids don't know what hope is. And really adults don't know what hope is. We're not taught what is hope and how do you get to hope. And also we're often not taught about hopelessness. Feeling hopeless is a normal part of life. And we can feel hopeless about one thing, several things, many things. And we just have to learn how to proactively manage that hopelessness. And we really need to teach kids how to do that. There are all kinds of positive outcomes as it relates to hope and hope in the school system. They when they're more hopeful, they think they can find a good job in the future. But a lot of kids don't feel like they can find solutions to their problems. And so we really work hard to do this. So the impact of hopelessness on students, again, that feeling of despair and that sense of helplessness, bullying, it's high. If you're bullied, you're more likely to be hopeless. If you're a bully victim, you're more likely to be hopeless. You're more likely to struggle with anxiety, depression, and suicide. Again, hopelessness is a primary symptom of anxiety. It's also the major symptom of depression and the key predictor of suicide. There's a lot of research on hopelessness that we share on hopefulminds.org. You can find the links to a lot of these studies, but it's also predictive of weapon carrying on school grounds. So a child's level of hope is predictive of if they'll bring weapons to school. So there's a direct correlation. Addiction, high hopelessness leads to addiction. It leads to self-harm, violence against others, dropping out of school, not being engaged in the classroom. So hopelessness impacts the school, classrooms, and students very significantly. But the opportunity, again, is hope is teachable. And the first thing we need to teach kids is that hope is teachable, right? People don't understand this, and we need to teach the power of hope and the science of hope, and take it away from thinking hope is just kind of a wish to hope is both positive feelings and inspired action. So there is an action component of hope that is often missing when we talk about it in the general conversations, and yet it is a key part of the science of hope. And the impact of higher hope kids get better grades, they have increased attendance in school, they have improved sports performance. So, you want to get kids excited about hope, they'll do better in sports. They're more focused, they're more engaged, they're less disruptive. They have stronger, better friendships, which is so important, better problem solving skills, and they're more creative. Hope is located in our upstairs brain that we teach kids about. And that is where our problem solving, where our creativity, where all of that happens. And so it's really key to teach kids how to get, out of that downstairs brain and stress response into that upstairs brain, how to stay there, and then how to start solving problems. Hope is also an independent variable. So we've been doing research with Ulster University on our program. We did it on the 10-lesson curriculum and the 12-lesson curriculum. And we looked at things like hope, and then resilience, depression, anxiety, negative emotional response, positive emotional response, emotional control, stoicism, support seeking, and self-care. We also did focus groups there and then around the world. And we do see hope as an independent variable. The more hopeful you are, the more likely you are to be resilient. And we know in the literature that hope is a known, it's a kind of a baseline. So you have to be hopeful before you can be resilient. So, if you're teaching kids about resilience, that's important, but you also have to teach them the bedrock, the foundational skills of hope. And we know that as we actually increase hope, we decrease anxiety and depression in young kids, which is pretty phenomenal, because this program isn't actually even intended as an intervention. It's intended as a prevention, kind of just awareness, and start building skills and practices. But we saw that as we increased hope, we decreased depression and anxiety scores and symptoms in youth, which is so powerful. The literature is very strong in that hope is a known protective factor for anxiety and depression. So the more hopeful you are, the less likely you are to be anxious or depressed in the future. And yet the reverse is not true. So your anxiety and depression do not predict your future levels of hope, which is very important for those with lived experience. Because even if you're anxious or depressed now, it doesn't mean that is going to be your future. You can practice skills and learn tools and techniques to elevate your hope and help navigate and help prevent future anxiety and depressive episodes. So really important. And, hope impacts everything in our life. So many things that we care about for humanity is impacted by hope. But again, we talk about hope, but little has been done to actually teach hope as a skill and to start operationalizing hope. And that is what our aim was with Hopeful Minds. Hopelessness is not a student's fault. It's a consequence of discrimination and oppression. It's very learned, and yet it can be reversed. So again, hopelessness is that despair and that helplessness. And we have to empower and teach kids how to get out of that despair to positive feelings, and how to get out of that helplessness to inspired action. We teach kids how to manage and identify their feelings first and foremost, and that feelings aren't good or bad, but they are positively or negatively charged. And when we're in those negatively charged feeling state in our downstairs brain, the best thing is for us to really observe and learn and listen, and not act when in that state, but really to let those feelings talk to us and tell us give us messages that we need to receive and learn from them. And we need to express those feelings, right? And not act out from them. When we act out from those negative feeling states, we often turn to things like addiction, violence, self-harm, because it really feels better in the moment than feeling those negative emotions. And yet the reality is, if we can just learn to sit through our emotions and listen to what they're telling us, they can be really informative and teach us a lot about ourselves and what's working for us, what's not working for us, and what we want for our future. So hope is having an expectation that is desired and it's possible. Again, it's been defined in many different ways. I actually wrote a book about hope, the biggest little book about hope. And I talk about that it's, it's desired, but it's also possible, and possible gets to that motivational component of it, and how we set SMART goals and teach kids the importance of setting SMART goals: specific, measurable, attainable, relevant, and time bound. So, a process for forward movement when we feel so helpless, how to chunk down goals, how to navigate new pathways, when even we may need to set new goals, which is definitely sometimes necessary. And hope is a universal concept. So we're using this all over the world, and everyone understands the idea of hope. But so this program, again, it's free. It's universal, and yet the challenge has been, how do you teach it? How do you operationalize it? So that's really, we have an incredible group of advisors that really helped us. My main advisor is Dr. Myron Belfer. He's amazing. He speaks on the Health Day. Then we've presented a lot on hope. He's a child psychiatrist. He worked with a Nobel Prize winner that did transplants, and the first human transplant, amazing. But he saw that, that how the Dr. Josephine Murray worked with future orientation and focusing on the future and not so much the diagnosis, but how are we going to act? How are we going to get to action? What is the kind of the vision for the future, and how can we feel good about it, and how can we take steps to get there? So Dr. Belfer really works in the research and helping me really improve the research we're doing on it and the theories and some of the medical and biological to how we're teaching it. So it's really exciting. So Hopeful Minds, we have two versions of it. One is an overview, teaches the what, why, and how of hope. There are 3 lessons. They're 45 minutes each, and they just really we actually, I'm super excited. We have a Spanish, Espanol. That's about all my Spanish. But we created a Spanish workbook. So there's, the curriculum's in English, but we do have the Spanish workbooks for the children, which is very exciting. And then we also have, and this is what the curriculum looks like. So you can order the curriculums on Amazon, and it's really exciting because we redid them all. And they have teacher scripts. They have a lot of background for teachers. So a lot of the science around hope and why, and the biology and behavior and how it's interconnected, and HRV and what heart rate variability is and how that connects to breath and our stress response, and really all of these exciting new kind of innovations and ideas around hope. And we take, and then we have scripts, and we have workbooks, and we have questions, and we provide answers to the questions. So you don't need to be trained in this. It's, my big goal was to make it free and available to all around the world, because we all need to know how to get to hope. We have many things to be hopeless about these days. And so we all need these skills and strategies that we can start using and applying to the different challenges that we face. And so again, this is all free, available to anyone. So how to get to positive feelings and inspired actions, overcome hopelessness, and creating a network. So we all need at least one person to talk to, especially in times of stress and duress. And so how do we create that network? How do we cultivate it? How do we ensure every child around the world has at least one person they can talk to? Dr. Belfer said this is key. This is really important. Does a child have a best friend? And if not, if you're a teacher, can you serve as that support for that child? Let's make sure kids are connected and know who to go to when they're feeling challenges and when they're feeling hopeless. I just interviewed a group earlier today that hopelessness in youth and in teens is at unprecedented levels. We feel hopeless about so much. It's overwhelming. The good news is and the powerful aspect of this is we need to get this message to teens and to ourselves, really, and to adults, but especially I'm so passionate about teens and our youth, that hopelessness, we can define hopelessness. And so once you can define something and you can measure it, and once you can define the opposite, you can start learning how to get there. So no matter what and how hopeless you believe your situation or your life or a challenge, you can start practicing skills to get to hope. So, hopelessness isn't going to be a fixed forever thing. But we have to get kids these skills. So that's really the goal, teaching that, you can learn how to hope. And we need to learn how to hope. We're not taught how to hope. So how do you do that? And so this is our aim to do that. The other thing we have are the 16 lessons, the deep dive. So again, we went really deep You can, again, hopefulminds.org. You can download all of these materials free, print them off. You can find local sponsors to print booklets for you. You can download the workbooks. This is our deep dive. And this is like everything I ever wish I knew about mental health, really, but through the lens of hope. And we have, and all of like, we have worksheets that you can do, posters for the classroom. We have Hope Heroes. So we have a Hope Hero for each lesson and how these Hope Heroes applied these skills to their life to overcome some challenges and how it led to their success. So we have that. We have a workbook that goes along with it. We also have this Hopeful Minds. Oh no, this is the overview, sorry. We have a parent's guide. So how do you start using hopeful language at home? It has posters, what are happy habits? What are stress skills? What are your favorite stress skills? What as a family do we practice when we're triggered and our stress response is activated? What can we practice to stay in our upstairs brain? So things we do for joy and happiness, exercise, nutrition, games, laughter, what are we doing as a family? The family is so important. And yet I also acknowledge that a lot of kids don't have healthy family environments. And so while it's wonderful if we can get the parents and the families involved, the reality is a lot of families are unhealthy. And so getting these skills to kids and to young kids so that no matter what is going around in their environment, they at least have some tools to navigate that, And, the BBC did a documentary in our program, and not just does it help the kids navigate their own stress response, but it also helps them see where others are in their emotional state. And when you notice others in your stress response, maybe you back off, maybe you don't engage at that time, maybe you do something different. So it's not, and this is really powerful that these kids kind of came to on their own. Oh, my brother's in a stress response, so maybe I shouldn't, maybe I should just let him be, take a shower, do something else, and then maybe the next morning things will be better. And it's really powerful to hear kids talk about how they apply these lessons in their life. So I'm super excited. These are, we have incredible advisors that I'm really grateful to have on our advisory board that have been working with us. This is a scalable solution. There's no cost to entry. Anyone can go on and download it. Anyone can start teaching it now. Hope is a universal phrase. We just have to start teaching the how to hope. And we know from a financial standpoint that the investment in prevention for mental health or in intervention is 4 to 1. And so for every $1 you invest, you get $4 back. So why you wouldn't invest in intervention, I'm not really sure. But it's also that for every $1 we invest in prevention, you get $18 back and over return. So it's super important that we invest in prevention. And, we often wait until problems are massive to really start addressing them. And that's very true of mental health, anxiety, depression, suicide, addiction, all of these. We address them at the time of crisis. And we really need to be more proactive about how we talk about these things with kids and in school systems. And I am a strong believer that it's way more powerful to do so through the lens of hope and hopelessness, because it's not, you're not diagnosing someone, you're really just teaching them how to manage this and how to manage this hopelessness proactively, that helplessness and that despair, and how to be proactive about our hope. And, again, when we're going to go through stressful times, we want to amp up everything we're doing that helps to foster and grow our hope. Because it, again, is that protective factor. And we know that major life events can trigger anxiety and depressive episodes. So when we're going through major life events, that's really when we want to be even more so proactive about our skills. When, unfortunately, oftentimes that's when we let them go. And that becomes a major challenge to remaining hopeful and staying in a positive, healthy, productive place, which is really all we want to do here in this world. So anyway, I'm super excited to share with you this work. I think I'm about done. I also want to just share that we have a Hopeful Cities campaign. So we are now operationalizing hope throughout cities. It's hopefulcities.org. We teach you how to bring hope to your city. It's in both Spanish, and we've done some English. We've done English, and then we've done some Spanish work as well, and anyone can translate it to any language. We have signs, we have billboard creative, we teach you how to raise money from other nonprofits. We have the curriculum you can bring to the school system. We have the 5 Keys to Hope posters that you can put up in workplaces and start talking about hope in the workforce. I do a lot of workplace training around hope and how to improve hope among your employees. And I teach the 5 Keys to Hope. What are the 5 Keys to Hope? How do you grow, create, maintain, and grow hope, and use those keys and activate those keys in your life? So I'm really excited to share that too. We just launched it. We created a free 30-day global hope challenge that takes you through the science of hope in 30 days and like quick little tidbits. And we aim to improve, and we'll grow and improve and continually do that as we develop and grow this work. So thank you so much for having me today, and for caring about hope and for caring about our kids. And this is where we presented Hopeful Minds. I can't believe it. It's such an honor, and it's like to take a step back and just appreciate how far this hope work has come, and from starting from that seed of knowing that hope is critical, and it's critical for me and to prevent my own suicide, right? When you're told that you have a really high probability, it's like, how do I stop that, and how do I become an engaged, productive, effective, active person in life? It's so important to me. And then how do I take that and support other people in doing the same? So I'm just grateful for those that have given me the opportunity to speak and present the work and help grow the work and learn, because every time I speak, I learn from people. And ways to add and improve and adopt, not stop questioning. Anyway, this is, our work at IFRED, and just how you can find the Hopeful Minds program. And once you choose hope, anything is possible. So you've got to choose it first. Like I say, I can't give people hope. I lost my dad to suicide when I was 18 years old, and he was amazing and a great influence on my life. And I couldn't give him hope, and he had to have wanted it internally, but I can give you the how-to of hope. I couldn't give him that. I didn't know it at the time, but I know it now, and I believe it's a human right, and everyone deserves this knowledge and is, but what you do with it is up to you. How you activate it in life is, I can't get you to practice and do the exercises and to care about it and to work with your kids on it. I can just share with you and continue to provide what we know about it. And it is my greatest desire to support all of you in your journey. And hope is so key to happiness. Hope is a foundation. It's a bedrock. We all need hope. I feel like happiness is like, then we get to happy. That's, the company is all about happiness. How do we continue to stay in that positive, productive, engaged, energized place? So anyway, thank you all for letting me share here and talk about something I'm so passionate about, and share with you what we know around hope. And I hope you activate it in your own communities and teach your own children and the children in your communities, and because it is possible. So thank you so much. Feel free to reach out anytime. My email is there. I do appreciate it, and I've loved sharing with you today, and I wish you all a wonderful day. Thank you.